The last time I was at the OCCUCON was in 2018, but at that time I came in as an emergency medicine and disaster medicine expert. That's my area of specialization. But today I'm one of you. I stand here as a preventive health, I wouldn't call it expert, but at least a novice, a beginner in the world of preventive health, because I happen to chance on something that really can help save lives. And that is what I'm trying to introduce you to today. So my topic is saving lives with preventive AI-enabled health screening. So we use artificial intelligence. But let's get to first things first. When we say healthy, we're talking about health all the time. What do we mean? Hippocrates, considered the father of modern medicine by the Western world, because today we take the Charaka oath, not the Hippocratic oath. But he said, health is the greatest of human blessings. We have another father, the father of our nation. He said, health is the real wealth, and not pieces of gold and silver. I think we're getting ready for Republic Day, yes? I've never heard so many planes flying at the same time in my life, yeah? So there it is. But we all love the WHO. Yes, we talk about the World Health Organization, which clearly says health is a state of physical, mental, social well-being, not merely the absence of disease. So our approach to health should not be disease-based, but health-based, right? And when we are marking health, we talk about people dying. What's killing India today? That's the question. And unanimously, if I ask any of you, you will say heart attacks. And that is correct. India's number one killer is heart attacks, right? And then we have lung disease because of the pollution that we have, and cancers. Cancer is no longer a disease of the West. It is a disease of India as well, although the incidence is less. Unfortunately, in India, when somebody is diagnosed with cancer, people die. That's it. And our movies are not helping us. In our movie, we want to kill somebody. You know, we say, Babu Mashai, Zindagi badi honi chahiye, lambi nahi. Yes? So Rajesh Khanna. We think cancer is the end-all disease. That is not the truth. We shouldn't be thinking like that, because we are seeing over 11 lakh new cases of cancer every year in our country. And we should be screening for it, and we should be handling it. So let's look at some of the problem statements. Should I be worried? Yes, okay, so yeah, you're talking about diseases that are affecting Indians, a lot of Indians around. Should I be worried? Yes, we are spending. The corporate world is spending. Occupational health is the cornerstone of preventive health. You are the people who first started with preventive health. And then the general population thought about it. You are thinking about your workers. You are thinking, my productivity has to be high. My workers have to be safe. Then my efficiency is great. Yes? So your cost, if just treating heart disease, is close to $350 billion across the world, right? And 45% of heart attacks are all silent, meaning till the heart attack happens, nobody knows that there's going to be a heart attack. One fine day, somebody has a heart attack, and whether they survive or not, it's like a toss of a coin. Yes, that's how late we leave it. And we think heart disease is a disease of men. Well, let's wake up. Heart disease is also the number one killer of women in the world, okay? Let's move on to another disease that we just think is very normal in India, diabetes. Diabetes, we think, oh, sabko hota hai, sugar. It's okay, no problem. We are now the most populous country in the world. I hope you know that. Yes, we have overtaken China as of 2 days back. We have overtaken China. Diabetes, China still leads us, but it's not too far away when we will become the number one country overtaking China. Because as the world increases in diabetes by 50%, Southeast Asia will be 75%. So we will rise faster than the world, and it will become a problem. Cancers, top 10 cancers in India, oral cancer. It's a unique problem that you will find in India. When you see number 2, 3, stomach cancer, lung cancer, that's there in the rest of the world. But oral cancer is an Indian problem because of the kaini, gutka, tambaku chewing. Right? So our number one cancer is oral cancer. Women, number one cancer is breast cancer, which is true across the world. If you put all cancers in one box and breast cancer in the other box, it will still be higher in number. That is why so much awareness. Even in India, we have awareness. We celebrate Breast Cancer Month, October. We do that, yes? But then, of course, cervix, uterus, ovary, and then lung cancer, stomach cancer, also oral cancer in women. These are the top 10 cancers among women in India. Why am I talking about this? It's because we want preventive health to focus on this. And that is the reason I'm showing you the problem statement. Unfortunately, like I said, in India, cancer, and this is government data, cancer is diagnosed in stage 3 and 4 80% of the time. Only 20% of the time we do stage 1 and 2. That's why our cancer survival is very poor. Our screening programs don't have cancer screening in them. We don't like to talk about cancer. Somebody in the family has cancer, we don't tell our relatives. Say, nahi, kisi ko mat bolna. Don't tell anyone. This is how we approach cancer. We don't even think of screening about it, and that is what the government data is telling us. And like our doctor, Pankaj, who was here, well, like he said, it's great to see that this is the most focus we've seen on health in our recent 45, 50 years of governance, right? So I'm really, really happy to hear all of that. Right. So what is the cause of all this? We all know it's lifestyle. I love this picture that comes up. This is a beautiful lady, right? When she's making the right lifestyle choices, great quality of life, very pretty, very beautiful. When she's making the wrong choices, junk food, substance abuse, not sleeping enough, the quality of life becomes very poor. So that's the problem. And then we have lifestyle diseases. Yes, we have a lot of them: obesity, thyroid, anxiety, diabetes, heart disease. Everything is a lifestyle disease. The root cause is poor lifestyle, which all of us are guilty of. But the big killer is obesity. It is the silent killer today. As more and more people become obese, we are losing more and more people to lifestyle diseases, and deaths are more frequent, right? And these are all preventable. So how do we prevent it? We create a better lifestyle by giving up some old habits and picking up some new habits. So where do we get these new habits from? That's the question, isn't it? I already showed you this. I want to show you one country that beats this trend: Japan. If you go to US, heart disease #1 killer. If you go to UK, heart disease #1 killer. Japan is the only country where heart disease is not the #1 killer. Why? Because in 60 years, they are doing annual health screening. And I'll show you annual health screening. So some of the principles that they follow allows them to do this. So if you see the population distribution in Japan, the most healthy population, or the largest amount of people living, the density is between the age group of 45 to 70. Let's look at India. And you already know that the graph is bad. Yes? Our healthy population lives between the age group of 15 to 45. When you see after 60, not many people live in India. The unfortunate thing is we are accepting of this. We accept after 60, okay, if somebody dies or the population not there, it's okay. We think we're already old. It is wrong. When another country can live healthier for longer, why are we thinking like that? So what is it that the Japanese are doing right? 7 principles of healthy living. We have something called as ikigai, purposeful living, having a social purpose in life. Whatever you do benefits your fellow man or woman, and then you feel like, yes, I accomplished something. You want to live great lives. And then there is haraha chibume, eat only till you're 80% full. In India, we don't like to follow that. If I go to my friend's house and he didn't force me to eat, I feel, yaar, usne mehman nawazi ki hi nahi, khatirdari nahi ki. And it's vice versa also. And when I go to my in-laws' house, I'm guaranteed to put in 2 or 3 kgs. The son-in-law has to be fed. Of course, the son also. I wish I would think like that about daughters as well, okay? But I'm not going to get beaten up right now. Of course, the famous Japanese green tea, the matcha tea, antioxidants. Some other principles: walk more, live more. Mealtime principles: the family that eats together lives longer because you eat controlled portions. If you eat alone, junk food, bigger portions. And of course, respect the elderly. So the elderly love to live long. But I'm not here to talk about all of this. I'm only here to talk about one Japanese healthy living principle, which is proactive health screening. In Japan, when you join a job, from that year, you do annual health screening, period. And you have to give your reports to the government. That is how it works. So that means from the age of 23, 24, everybody is getting screened once a year. They're not waiting for a disease to happen, and they're doing it till they reach the age of 60. Once they retire, the government sponsors this. So throughout the year, their life, they can get health screening done free of costs. They can do it. So they screen. How has this benefited Japan? Japanese live on an average 15 years longer than Indians. Our lifespan, 69. Japanese, 84, longest in the world. It has the highest concentration of people above 100. Survival rate for cancer, if you see breast cancer, 90% survival. India has the most awareness for breast cancer, still 67% survival. That's it. Stomach cancer, 9% survival in India, Japan 60%. Lung cancer, 4% survival. Yuvraj Singh, Sanjay Dutt, lucky people. Not many people survive. Japan has the highest, and that is also still only 33%. That's why screening becomes very important for survival. So, like I said, unfortunately, our country health is not valued till sickness comes. We are a disease-based environment. And we always think of all of this when we talk about healthy living, that is nutrition, exercise, self-connect, travel, but we don't talk about screening. There is no scientific evidence on screening or screening papers that we have from India. How much percentage is getting screened? What is the disease that's picking up? We don't have it. We don't even think it's important. Yes? So that's the problem. So let me talk to what we do in screening. we know disease, you wait for it to happen, you do the investigations, and then you treat it. Whereas screening, you don't wait. You screen, you find the disease, you treat it before it causes trouble to you. That's the idea, okay? So that's the difference. So this is where Noura comes in. So let me talk in the next 7-8 minutes about Noura and what we do and why I'm here standing today, an emergency physician talking about preventive health. So this is AI-enabled health screening. Noura is the first of its kind health screening center based in India. It's a collaboration between Fujifilm, the camera company, which is also a medical imaging company, and DKH, Dr. Kutty's Healthcare. So what do we do at Noura? This is us getting inaugurated in Bangalore. That's the Japanese Consul General on World Cancer Day. And our second center is in Gurgaon, July 21st. This is our second center. Of course, we also now are open in Mumbai. So why Noura? Why not any of these regular health checkups that you do? We're different. We use artificial intelligence. Of course, I talked to you about that. We also use ultra-low dose radiation with a CT scan. We use only X-ray level radiation. And we give you reports immediately within 2 hours. So some of the things that I'll talk to you about is our ultra-low dose CT scan. The DEXA is a bone scan, checks your bone density. There is oral cancer. Yes, oral cancer, big problem in India. Mammogram, I'll talk to you about that as well. And colposcopy. These are some of the technologies along with blood tests that we do. Okay? Right. So CT scan. Normally when we do a CT scan, like we did for COVID, a CT chest is 15 milligray, right? Which is 50 times an X-ray. What is recommended for lung cancer screening today is 2 milligray. So US, France, they recommend 2 milligray. That's 10 times an X-ray. What we do is equal to that of an X-ray. It's a 0.2 milligray. But there's a problem. You see the image here? That is the image you get with an ultra-low dose CT scan. Yes? The image you get in the middle is with high-dose CT scan. What we do, we take AI and clean up this low-dose image to that high-dose image. So we don't use the high-dose radiation, but we get the same quality image. And we are a dual AI model. The second AI will clean up and pick up that lesion which could have been missed in the naked eye in that picture. And then it shows it to the radiologist. So usually there's a CT scan and a radiologist. He has an ultra-low-dose CT scan, AI, then a radiologist. So the accuracy is going up, the safety is going up, and the speed is also increasing. So that's how our CT scan works. So this is what Noura does, right? So this is lung cancer. If I do chest X-ray, that's what I'm going to see. I'm probably blocking people. If I do a CT scan, I can identify nodules. So that is why the US Preventive Services Task Force says people should be screened with a CT scan for lung cancer, not with an X-ray. And that's for family history, smoking history, anyone above age of 50 also. And the ones who are less than 50, if they have smoking history, you have to get screening done, right? Of course, so we have identified a few people. Look at this. That's the nodule we identified. It's behind the mediastinum. It can be missed on the X-ray. Another person, again, same similar problem. Again, behind the mediastinum in the apex. If you do an X-ray, you will miss this nodule. And believe me, these are people from the insurance industry who have identified. Unfortunately, people with access to screening every year, they have missed this, right? Mammogram. Traditionally, when a woman undergoes a mammogram, the first thing she's thinking is pain. It's painful. A mammogram is painful. No woman wants to do a second mammogram in her lifetime because it's so painful. We have reduced the pain. Every woman, we have screened about 3,000 women at Noura. They're all happy to come back and do the mammogram again because it's a fiberglass, it tilts, evenly distributes the pressure. So, no pain. Yes, some discomfort, but that's much, much less. People are very, very happy to undergo the mammogram. Also, the level of image, it's a tomosynthesis. So routine mammogram is that 2D image, and then the tomosynthesized image is what we get at Noura. So already the quality of image is better, plus we use AI. Our AI, we tested it on Japanese doctors. Without AI, they were able to identify this lesion in 2013. The AI was able to identify it as early as 2011. If you see, if I'm treating in 2013, that lady loses her breast, and there's extensive chemotherapy. If I'm doing it in 2011, minimally invasive, very minimal chemotherapy required. So this is why we should detect this early. This is a success story that we have. She's the wife of a billionaire, the founder of a company called Zerodha, the kites app that you use. She writes in her blog, I am or maybe thought I was the healthiest and fittest person that I know. We screened her at Noura. We found stage 2 breast cancer for her. She went to the US, got treated, doing great. If she hadn't screened at Noura, and the disease had progressed, that course of events could have been a different story. And she blogs about it. We have her permission.
One more minute we have in the interest of time.
Yes, sir. I can hear you. Yeah. 2 more minutes. Right, okay, thank you. Okay, so heart calcium score. This is my favorite test. This is for heart attacks. You do an ECG, you do an echo, it won't show a heart attack until it happens. Yes? But a heart calcium score can actually tell you the calcium deposit that's happened already, a fixed plot, which increases your risk of heart attacks. And we can tell them which artery it is. We color coded so people can understand. Yes? And we were able to identify it for over 500 people, and we were able to save 500 lives, including people who own big companies. They have come back, given us testimonials, and told us that we really saved their lives, including 2 of my own uncles. So that's why it's one of my favorite tests. Yes, so we can identify critical stenosis. And colposcopy, we always want to do a pap smear, but a colposcopy is visual assessment for cervical cancer, so we can see it. And there are multiple papers which compare colposcopy and pap smear. What I want to focus is on sensitivity, the number. You see, if a pap smear says no cervical cancer, you can trust it 28.5% of the time. If a pap smear. If a colposcopy says no, you can trust it 85% of the time. So the sensitivity is much higher. It's a rule-out test. So we do colposcopy, and we're planning to add HPV DNA as well. So yes, this is FitKit. This is for colorectal cancer. It's a simple motion test. The NHS believes this, the NHS UK, and they say it is 97% sensitive, and it can pick up colorectal cancer before symptoms. Maybe we could have saved Chadwick Boseman, Black Panther, if he had undergone a FitKit, right? So yeah, visceral fat, we also look at visceral fat, just a minute more. So that's the red color that you're seeing is visceral fat, obesity. So it's much better than BMI and hip-waist ratio, and it's the most accurate indicator of the amount of fat you have. And we've been able to show this to people. So yes, all of this is done. So we have blood tests and then imaging, right? Oral cancer screening, we have CT, we have DEXA to give a good idea. Then we run it through the AI, we show it to the specialist doctor. AI is a support tool, and all of this is done in 120 minutes. In 2 hours, you get all of this done for you. And we also give the report as ABCD so people can understand, no confusing numbers. And it's a non-fasting test. We do all of this, right? This all comes, it's part of it. And we also do genetic screening now. And these are our early believers, people from your community that have accepted, and they're all part of what Noura does today. They're all sending their employees to Noura they understand the values that it brings to their employees. So that's all that I have to say. We are at 3 places, Bangalore, Gurgaon, and from day before yesterday, we are in Mumbai as well. All I want to do today was welcome you to the Noura way of life and welcome you to Choose Health. Thank you. Thank you so much.
Thank you. Thank you, Dr. Tausif, for this excellent presentation and an eye-opener on AI-enabled healthcare.
Yes.
So may I request my questions? Any questions? Yeah. So any questions from the dais?
Yes.
Yeah.
We have to go to Gurgaon only, or there is some empaneled hospital also you are planning?
You have to go to Gurgaon only. We're not available any hospital at this point of time. We only have 3 centers. We started 2 years ago in Bangalore, then we started in Gurgaon in July, and in Mumbai. Technology is not available at a hospital yet, although a couple of hospitals have approached us and said, can you take over our screening center space? But that has not yet happened. It's still discussion phase as to how that can be enabled. But at this point of time, I'm sorry to say, we are only at Gurgaon. If you come to Gurgaon, you can experience Noura screening.
My second question is how you are taking care of the cost factor, because the annual health screening checks in hospitals.
Yes.
I think the kind of investigation that you have put into this Noura health screen, cost-wise must be much more than the other hospitals' annual health screens.
If I take each individual scan and test, it should cost you nothing less than 40,000 rupees because of the number of scans and DEXA. Yeah. Noura at Gurgaon is doing it at 18,000 rupees. That's the cost for the retail person. Yes, but when there are companies tying up, of course there is some sort of up and down happening on the cost. But that's how we're managing.
Yeah, that was my last question. You have any corporate plans?
Yes, we do.
All right,
of course, we definitely do. Yes.
Thank you.
Right. So that's there. The idea is when we look at traditional health checkups, like I said, first and foremost, they're not looking at cancers. They're not looking at bone density, because bone density, although we think is a disease of the elderly, it's not. When you're identifying osteoporosis in the elderly, what can they do about it? They cannot exercise, their digestion is poor, they cannot eat right. It is only when you identify it, because it starts at least 10-15 years early, the process. So identify it at that age, you can eat right, you can exercise more, and you can prevent osteoporosis from happening. So that is not part of the routine health checkup. So we are trying to change it. Like Henry Ford said, if I had asked people what they wanted, they would have asked for faster horses, not for a car. We're trying to change from horses to a car and do what is best for health screening. That's the idea. Thank you.
Doctor, I
Thank
have a
you.
question.
May we have a round of applause, please? for
Thank you,
Dr.
thank you,
Tausif?
thank you.
Yeah.
One more question? Do you want to finish?
Yeah, please.
Yeah.
So, Doctor, I have a question. Like, after introducing two-layer AI,
Yes.
if I compare with a traditional machine and your machine, right? So, after introducing AI, how much X-ray doses your machine is reduced so far? Let's say I have 100 doses in the machine, in traditional machine, and after introducing AI, this is 40, 20, or how much is?
So it is a 97% reduction, if you can believe it, right?
So-
the whole scan is
so
equal to one
103.
abdominal. Yes.
Okay.
Yeah. The whole scan is equal to one abdominal X-ray. That's it. That's a 97%
Great.
reduction in radiation. Right.
Well, thank you. Very insightful. I think no
Thank
need
you.
to Google why Japanese live longer. Now we have the idea.
Thank you so much, sir.